heard about. I want to just briefly go through my story a little bit, because if I was in y'all's shoes, chiropractic's not one of those mainstream things. I'm a chiropractor, by the way. Isn't one of those mainstream things where you think about that would come and talk to you and talked about, sensory issues or challenges or anything to do with what we're going to talk about tonight. I started off seeing a chiropractor actually when I was really small, like third grade. I had scoliosis when I was a kid. A very structural issue where the spine doesn't grow straight, it's curved. My pediatrician at that point actually sent me to a chiropractor, and that was my first experience. 6 months later, my back's straight, very reactive in the approach, everything's good, and that was it. And then a little bit later, I was involved in some car accidents, had some migraine headaches from it, went back to a chiropractor, had some great results from that. Anyway, through like my journey and like life, I decided, hey, I want to go to chiropractic school. Not really knowing what chiropractic was, thinking of it more as a tool to help pain relief, if I was in an accident or a fall, or help people feel better, which is still great, but it's a lot more than that. And that's what I learned as I was going through chiropractic school. As I started into chiropractic school, I noticed I had an autoimmune disease growing up. I had a condition called alopecia areata, where you actually lose big chunks of your hair. 7th grade, I was actually completely bald. And I started noticing some of these challenges that I'd had as a kid actually start to resolve when I was getting adjusted, which is where we start to realign the spine, get tension out of the nervous system on a regular basis. And I started saying, hey, there's something to this. What's the difference, or why is this not just pain relief? What's going on? And so we started asking a lot more questions. About halfway through chiropractic school, me and my wife had our first child. And well, let me back up a little bit. Before that, my focus in chiropractic school was mainly sports. Like, I was an athlete growing up, loved working with football players and basketball players, and I wanted to just connect with athletes to try to help them perform better, recover faster. And that takes me back to the story of my daughter. Our first child was born, and to make it short, the long story really short, she was born with a dislocation in her neck, and she pretty much wasn't breathing. When they got her to the NICU, she was at 21% oxygen. We got her out of the NICU 6 months later. She was on a ventilator, on a G-tube, and we got to love that child for 5 years. But when she was born, it totally shifted my focus from athletes and performance to kids and families, and hopefully helping as many families as we could not go through that situation. At that point, I started with an organization called the ICPA, which is the International Chiropractic Pediatric Association, and started focusing on learning how to take care of moms, how to make sure they had the most efficient birth process possible, so they didn't have the interventions that we had. Trying to work with kids and focus on trying to help them optimize their ability to function. And that's what sort of started this whole process for me. A few years ago, I teamed up with an organization called the National Wellness Foundation. It's the nwf.org, and they are a group of doctors that really focus on these issues, these sensory issues. Because when I was going through that 120-hour diplomate program on pediatrics, we didn't have conversations about sensory. This was 10 or 15 years ago. ADD was maybe a little bit of known. Sensory processing wasn't even in the dialogue. Like, this wasn't even a thing 10 or 15 years ago. We were talking ear infections, we were talking constipation, we were talking GI issues, nursing challenges. Those are the conversations we were having through that. So this is all new. And to speak on that a little bit, this is the reason, over the huge change we've had over the last 10 to 15 years, is why we're not talking genetics. It takes thousands of years to change your genetics. So you didn't pass on anything not right as far as the blueprint to these kids. These aren't genetic issues we're dealing with, because that wouldn't change this drastically in 10 to 15 years. So I started working with the National Wellness Foundation. I started learning and working with a bunch of doctors, and we found one consistent thing that we found. It's almost like in our histories. Like this happens, and this happens, and this happens, and it just starts to explode into these sensory challenges. And so that's what I want to share with y'all today is what are we finding that is all correlated to create this perfect storm where we start to notice the ADD, the sensory, the autism spectrum, all these things that we're all dealing with. Here are my kids, here are my wives. So Magnolia's 10, she's our singer. She sings at county fairs and lots of fun stuff. Gabriel just turned 8, Annabelle's 5, and Simon is 17 months. So there's my crew. Just to speak on a little bit, but to give you some like in-your-face stats, like this is what we're dealing with. 1 in 50 boys have autism. 1 in 9 have asthma, 1 in 6 have learning disabilities, 1 in 4 have some other chronic illness, and 1 in 5 have a defined mental disorder. And these are just stats that are mind-blowing from where, like I said, when I was going through that program 10 to 15 years ago, that this wasn't even the case. So here's how it's going to work. The first step today is going to be awareness. Like we're going to go through what we learned or what we've sort of connected and put together as far as like this is the recipe that's creating these challenges that most people aren't hearing. It's not in the mainstream media, it's not in your newspaper, it's not what is normally being talked about these days. Chiropractic is that we're at a disadvantage. We don't have huge marketing budgets and huge pharmaceutical companies behind us. So this is how we can get the message out of what we're learning. We're going to give you some answers. We're going to give you, and the answers are more or less science. We're going to give you some science behind what connects these dots together, and then we're going to give you some action steps as far as what we can do as parents to start to find out if this is our child and what we can do about it. All right, so I know it's been a long day for most of y'all, but we're going to give you a test. Okay, this is called an awareness test. There are 2 teams. There's a team in black and there's a team in white. Your goal is to see how many times the white team passed the ball. Okay, if you've seen this before, don't say anything.
This is an awareness test. How many passes does the team in white make?
Alright, what'd you get?
Is 13.
13.
But did you see the moonwalking bear?
I know it's small, nothing really extreme. Right there's the moonwalking bear. And the reason is, or the reason that we showed you this, is to just say it's easy to miss something you're not looking for. So we've started collecting all this information. We've got all these connected as dots at work, but it's not something people are looking for. And so that's what we want to do is start to connect some dots and show y'all what this moonwalking bear is. All right, so we're just going to jump into it. I know we're all dealing with different struggles. All of our kids have different challenges. What we're going to do, and we don't work with the kids we work with, we don't do this necessarily, but what we're going to do is we're going to lump them all into one thing and just say, hey, all these kids are strung up, they're high stress, they're in tension, their nervous system isn't integrating the way it's supposed to. All right, so whether we're talking about digestive issues or sleep issues or sensory issues or mood challenges, like it can all be sort of connected through those same descriptions, okay? So we're gonna go through what is the perfect storm. All right, so the first connection that we made is most of the time the moms have fertility issues. When moms are under a lot of stress and tension, one of those challenges can show up as fertility challenges. Also other pregnancy during pregnancy or challenge during pregnancy. So is us, the moms out there, is pregnancy all happy times? There's a lot of, especially these times, these days, pregnancy, we see a lot of moms in our office, and pregnancy's become a very medicalized procedure. Wow, it's like picking up what I'm saying. I think you're spying on me.
Siri trying to help out. Yeah.
Anyway, anyway, so it's become very, it's hospital, it's very invasive. There's been a lot of things that are going on, and there's a lot of stress on moms. Moms are working, they're raising other kids, they're having, while they're pregnant, so there's a lot of stress. And the same thing that happens to the mom, the babies are winding up that same way. So the same adrenaline, the same hormones, epinephrine, norepinephrine, all these adrenaline stress hormones, the nervous system's going like this for moms, it's doing the same thing for the babies. So babies are starting off wound up because of all this stress that moms are going through their pregnancy. Labor and delivery. I'm gonna show y'all. I'm gonna exit out real quick.
No.
Okay. Interventions during labor and delivery. We'll go over this in a few slides down the road as far as how this has drastically changed. But if we really look at it, this is the biggest difference. This is what has changed over the last 10 to 15 years that has drastically changed the health of our children. And it's not something that is widely known, or they would change it. The birth process, whether it's vacuum extraction, these are things like epidurals, C-sections, vacuum extractions, C-sections, what else did I say? But any sort of those things that create intervention, there's a huge amount of trauma that happens to the upper part of this neck, the upper cervical spine. There's a huge implications. We're gonna get into a few minutes and I'll repeat it, but there's a nerve called the vagus nerve, which helps calms our kids down. That thing runs millimeters close to that upper cervical spine, or upper neck. And if that upper neck is not moving or not in the right position, it can really affect how that vagus nerve communicates and calms the body down. So here's sort of the story. Babies come out wound up, and now they have colicky babies. They're not nursing, they're not digesting, they're not pooping. All of these things start to happen with our babies as we start this process. Then we start getting sick. The biggest one that we hear on a regular basis is ear infections. How many kids have had an ear infection? I think the stat was 90%. 90% of kids over the age of 3 have had an ear infection. Like, it's crazy. And most of the kids have had more than one antibiotic at this point, so we're killing their gut. We're ear infections are a big part of that process. And then the next step is, now this high-strung kid is now getting sick, and now we've got some sensory challenges that are happening. We've got some behavior issues. And here's sort of how it's being looked at right now. So the fertility challenges have become so common that they're normal. Now we have interventions during labor which are considered normal. Now we have stress colicky babies, which is normal. And we're on tons of antibiotics and have ear infections. And these are all normal, common things these days because we've been so jaded by it and so used to what this whole pattern is that we're not really catching it till it gets to this. And it's the same thing. It's these kids are coming up so wound up. There's so much tension within that nervous system, and they're not able to have an outlet for it. But everything we've got, everything the current health industry as we know it, has created normalcy out of it. And so there's no red flags that come up until we get to number 5. And that's the biggest challenge. And they keep saying, oh, they're gonna grow out of the colic, and they're gonna grow out of the ear infections. You know, and it's, oh, they've got ear infection because their ear canals are more horizontal and not this. Yeah, they are, but I'm sure there's an intelligent reason. Like, we just weren't put together randomly. Like, there's some intelligence behind this. So, it's not just we're gonna grow out of it. It's now we've got stuck in that nervous system. That kids now got sensory issues because of this. But it started when they were conceived. It started that early that we started building up this whole story. As far as now, is what created this tension building up within the system. I want this to be a conversation, by the way. So if y'all have questions, if y'all have thoughts, like, we can address them. That's also what the piece of paper and pens are for. Like, yes, to take notes, but if you've got questions that you don't feel comfortable asking here, you might forget, write them down so that we can, like, talk afterwards. I'll stay after, we can talk it out. So, this is the gas and the brake pedal. And this kind of, I guess, answers all the things. So, what we know is that traumas, toxins, and thoughts rev up the speedometer, okay? There are two divisions to the nervous system. There's a parasympathetic nervous system, and then there's a sympathetic nervous system, okay? And this is where we're gonna get a little sciencey, so if I'm losing you, stop me. Sympathetic nervous system is fight or flight. It's adrenaline, it's go, go, go. As we said, it is make it make sense, it's your gas pedal, okay? This is when you're getting chased by a saber-toothed tiger. Like, you need this system to survive because it's gonna flush all the blood out of your gut and all of your central core, and it's gonna take it to the muscles. And when it does that, it's gonna help you run faster and lift cars off of kids and do all these crazy superhero things to try to survive, okay? Now you've got the parasympathetic nervous system. Parasympathetic nervous system is rest, it's relax, it's digest, it's sleep, it's heal. So, all of our kids, through the perfect storm scenario, way too early and way too heavily get tapped, that thing gets, and now we're heavy on that gas pedal, we're go, go, go. And so the littlest thing, not having one reset or two resets instead of one, these little tiny things, now we're at a 5 or 6, and so it doesn't take that much to spill it over the edge, and now we're in a meltdown. And as we talked about, and we'll talk about it again, like, this is where, if we've got some challenges up here and that vagus nerve isn't able to do what it's supposed to do to calm the system down, we're not able to unwind it. And that's what we do, is we start to figure out how can we start to unravel this. Most parents have a lot of this stuff on, like, a lot of this stuff is out there for most of the parents. A lot of the parents have thought stuff down. We've worked on parenting, we've worked on communication skills, we've worked with therapists possibly on this. We worked a lot with nutrition. We're dairy-free and gluten-free, and we watch what chemicals our kids have. And, you know, we really fine-tune this. The one thing that we haven't is that moonwalking bear that we talked about, is all these traumas. That trauma that happens at birth, or the stress that's put in the baby even before that. And as we're in this, and this is tacked on, these gas pedals create these challenges. And I know it's really small and you probably can't see them, but it's the ear infections and the ADHD and the behavioral issues and muscle spasm, constipation, and allergies. It's not, these aren't individual, they are different symptoms, but we can still put them in that box because they're all the nervous system being on sympathetic overload and not having a chance to unwind and get into growth and healing and relax. Makes sense. Okay. In a few minutes, we're actually going to look at a birth. We're actually going to look, and you're going to actually get to see, because, you know, it's going to be a very significant understanding about what can happen to the upper part of that neck during the birth process. Okay, Bruce Lipton is a scientist that studies epigenetics. To break epigenetics down, it's that your genes aren't stuck where they're at. Your lifestyle can change them. So you're not a victim to your genes, even if you've got a history of breast cancer in your family or heart disease, like, your lifestyle changes that. And Bruce Lipton is a guy that sort of pioneered that. when he has a quote that the function of the nervous system is to perceive the environment and coordinate the behavior of all other cells. So as y'all parents are thinking about kids, what word in that sticks out to y'all? Yeah. Most of the time when we talk about this, it's behavior. Behavior is that huge thing. What we need to connect with this behavior is the output. The output is always going to be in direct proportion to what the input is. So unless you change the input, you're not going to change the output. So the goal is the perception, the majority of your nervous system that you pretty much live your life through. So your nervous system, just to break it down simple, is your communication system. It's how information gets from outside and inside the body of the brain, how the brain can figure things out and then respond appropriately. But if your brain doesn't get the right input, if there's tension and stress and you're listening to that music that y'all came in with that was playing out there in the CrossFit gym, sorry about that, the nervous system can't calm down. It's not going to be able to perceive the information needed to the brain, and so therefore it's not going to be able to respond appropriately. So to change the behaviors, we got to change the input. The majority of that input is the vagus nerve. The vagus nerve is that calming, that sensory input. The majority of that vagus nerve is that input that goes to the brain. But that's also where we get into, and we'll get into receptors within the joints too. You've got receptors within all of your joints that shows you where you are in space. They're called proprioceptors. And if proprioceptors aren't firing off, they aren't feeding your brain good information. And in fact, if they're not firing out the way they're supposed to, they also fire out this other receptor called a nociceptor, which actually puts noxious stimulus into the brain. And that was a loud music that we were talking about. Dyskinesia is where we dive into that proprioceptor and nociceptor conversation. Dyskinesia is pretty much just a misalignment or a fixation. And this is where chiropractic has really evolved in its science in the last, well, I would say 10 or 15 years as well. Chiropractic used to have the understanding that you have your spinal column, T6 connects with the stomach. So if there's tension and stress, it causes T6 to do this. It creates interference within the nerve, and now T6 in the stomach, or the brain and T6 aren't communicating back and forth, and now we've got reflux, or now we've got some sort of stomach issues. And hey, Mr. Chiropractor comes along, adjusts T6, stomach communication happens better, and it resolves it. And you know what? It kind of works. But the science doesn't support it now. The science has evolved, and so I'm going to share that with y'all now. The biggest thing is it's more about the fixation. It's more about the joint not being able to move this. As stress comes into our body goes into fight or flight. It goes into protection, as we've said. Part of that process is that these joints actually misalign out of the normal position. Okay, and when it does, it fixates, so it doesn't move through a proper range of motion. When it does that, it's not able to fire off all those proprioceptors we talked about to feed the brain with good sensory input. If we look at the entire body, 60% of the entire input through those proprioceptors are from the spine. And 33% of those are from right here in the upper cervical spine, C1, C2. So if we've got that tension built up, that's where that input happens, or doesn't happen. Okay, so we're gonna watch this video. It's quick, it's like 20 seconds. Maybe a little more than that. I want y'all to do a couple things. One, watch, obviously, but also listen. And then we'll talk about
Come on, buddy. Here's a girl. Here's a girl. Make it cute for the can. Comes back and gets shredded.
All right. Yeah. That's a C-section, which in the general public, at least the moms I talk to after they've had a baby, they think, oh, I just had a C-section. That was easier on me, it was easier on the baby, there was less stress. No. No, and just, I asked you to listen too, did that seem like they were in any sort of panic over that? They were whistling through it, they were talking through it, this was a casual, everyday C-section that they think is totally normal. And if they knew the implications that they had to what was going on up here, they would be shocked, but they don't. Because what happens is, they're in charge, the OBs are in charge of your baby and you until that baby comes out. When the baby comes out, they wash their hands. They literally wash their hands and they don't hear any more about the story. They're gone. You go to your pediatrician. And the pediatrician picks it up and says, oh, they've got colic, that's normal. Or they've got reflux, here's some Zantac, but that's normal. We're seeing that more and more. And hey, oh, they've got ear infections now, we're just giving them some antibiotics, that's normal. And it goes back into that whole perfect storm. And if they saw that the whole way through, that would create the most significant change the fastest, because that would still be going on. And I'm not saying it's not needed. There are times it is needed, and it helps moms stay alive, and it helps babies stay alive, and some people wouldn't, some of us wouldn't be here if that wasn't able to take place. So it's great that it's there. It's probably just used a little more than it needs to be. And we'll talk about stats in just a few minutes, but the World Health Organization say that the C-section had about 5% of the population. It might be the next one we're talking about. Oh yeah, that's the good picture. So you can just see that tension and stress that right there, and the big, very important cranial nerve that goes right close to that could be, that was normally being affected by that challenge or by that situation. Here's the cesarean rates. So this is a huge upswing. We're like 30-35%. Like some OBs in hospitals are closer to 50. This is a huge change that has happened since I started with the ICPA program 10 or 15 years ago. We didn't have to have these conversations, to where we're at now, where we're having these on a regular basis with tons of parents and tons of moms that are suffering and they're having these challenges with their kids. And it's not that we've got all the things within this. Like, it's not to say we've got all, like, just because you didn't have a C-section doesn't mean that we don't have other parts of this perfect storm to make this happen. Actually, this study just came out, and actually I put it in one of my videos recently. It just came out 1st of September, and it correlated this so beautifully that it was great to add into this. So they did a study of 2.6 million births and compared vaginal births versus cesarean. And let me back up a little bit. Just because we had a vaginal birth doesn't mean that nothing happens, and we'll talk about that in just a second. But cesarean births had a 33% increase associated with autism spectrum disorders and a 17% increase in ADHD. So they're starting to notice and recognize that the significance of, or the correlation between birth and challenges and trauma and duration of birth and these sensory issues as we get older, or our kids get older. Here's a study. This is from an osteopath, and there's a lot of osteopaths that are almost more like chiropractors. They work with the joints and they work with the soft tissue, and they're not, they're just more like chiropractors. They think more like us than they think like medical doctors. And they did a study, and they found that 99 out of 100 children, regardless of their birth, they were found to have misalignments within the top part of their neck. That it started creating a lot of other challenges along the way. So, and what they also found is the longer the delivery and the more intervention, with the greater the dysfunction that was created by those.
That also mean the length of labor too, or just?
Totally, yes. I mean, it'd be the length of labor, force of contractions, and that's
Is there any information on like augmented labor? I'm just curious. Like Pitocin.
I would imagine,
Induced.
I don't know if there's any research, like anything out there, but I can just imagine that those contractions are probably a lot more aggressive.
Yeah.
So that would just be increased, I would imagine just be increased stress. And we work with a lot of moms on baby positioning and making sure everything's as as optimal as possible through that birth process, so that hopefully we don't have to have that. So one of the things that that we battle with when we're talking about pediatrics and kids and working with rewiring that nervous system is people's perception on what chiropractic is. So most people's perception of chiropractic is, I've got back pain, I go see a chiropractor, a few visits, my back pain goes away, I'm good to go. Symptoms are gone. When we're talking about rewiring the nervous system and input to the brain, this is a different conversation. Like 3 or 4 visits, even in once symptoms start or start to resolve, like there's still a huge amount of input and rewiring that needs to happen. And so we've got some objective scans that we use to actually be able to see and visualize what this nervous system's doing that help us to do that. But this is a process. And the longer it's been there and the more aggressive it's been there, the longer it's going to take. So this is pretty much neuroplasticity is what we're talking about. We're trying to change the way the brain functions and molds. But the blue part is age. And obviously the older we get, the older the kids are, the longer we've been dealing with this, the longer it takes to make these changes, because the body's hardwired in there. This great adaptability they have when they're young is good and bad, because if they're under that stress situation, they rewire to that faster. If we can unwire that and we can get things connected better, they also get adapting better, faster. So we have 5 Ds that we're going to go over, I think. Dyskinesia was the first one. These are the 5 things that happens when the body's under tension and stress and how it affects the nervous system. The first one was the things don't move the way they're supposed to, pretty much, and we get the fixations. The second one's disafferentation. Afferentation, to break that word down, is just input. When we talk about input and output, afferentation is how signals is the word for signals getting from outside or inside the body to the brain. It's the sensory input into the brain. And it's abnormal. And we've talked about this a little bit. There's proprioception and nociception. Proprioception is, hey, I know where my hands are in space. I've never had to do it, but it's all, if you're taking your alcohol test and you're trying to do this, they're testing how that sensory input is going to the brain. So, nociception's noise. It's that good noise going to the brain. And we already talked about this, but just to piggyback on it again, 60% of that good input going to the brain is in the spine, and 33% is in the upper neck. And so that's why it's so important that these joints that are typically affected by the birth process are realigned, are situated where they're supposed to be, and are allowing that nervous system to communicate the way it's supposed to. One of the other D's is dysautonomia. Your autonomic nervous system are the parts of the body that work by themselves. You don't have to think about them. It's blood vessels, it's organs, it's glands, it's things that communicate and just take care of themselves. It's your heart beating and your lungs breathing and your immune system fighting stuff off.
It's going to the bathroom, part of that too.
Part of that same thing. Part of that same thing is the control of things that work by themselves. They're the things that you don't consciously have to think about. They just run on autopilot in the background. You can't be in growth and protection at the same time. Your nervous system when you're born, or if we're not bound up in stress, their goal is supposed to be to grow and heal and adapt. But under stress, you start to go down. The body, the nervous system starts to go down into protection. As we get further and further protection, it creates vulnerability. We get vulnerable to, yes, the musculoskeletal things where most people compartmentalize chiropractic, but it's also energy, it's also sleep, it's also digestion, it's also all these other things. And now the nervous system's like this, and it can't grow, heal, and adapt. And so that's what we want to do, is try to get the nervous system growing, healing, and adapting the way it's supposed to. This is the nervous system chart. So this is the Merrick chart, pretty much. And it's not connected to the stent like I mentioned earlier, where chiropractic T6 went to the stomach and we start to trip these wires, and now we want to put the fuse back in and everything works again. But we can look at it in regions, and it still works in that capacity. So what this does is it pretty much tells us that map. It tells us what this nerves go to, what challenges, and then other systems that could be at play if there's a fixation that is creating that, not allowing that afferent energy or sensory input to get to the brain. With kids, sensory spectrum challenges like that, it's the upper cervical. I know we're beating it to death, but it's the upper cervical area. If we just look at this, it's colic, it's reflux, it's torticollis. So when these joints shift out in the neck, one of the biggest things that we see as this starts to happen, we start to get this all tightening down, we can start to get torticollis. And that's one of the things that a lot of the PTs start to connect with pretty young, is to try to start stretching that out. But they don't do anything that I know of, or none of the ones that I've connected with, to really start to reset how that top bone moves. They're just trying to adapt around it. We talked about the vagus nerve. There's some techniques to help stimulate the vagus nerve. So deep breathing is one of those. Your vagus nerve, it comes down, it controls your heart rate, it helps to sleep, it's digestion, it's breathing. If you can take a deep breath in, if you can get them to breathe a few times, that helps to calm the vagus nerve. So you can use it for yourself. It might be a technique that helps, you can add it with your kids too. Dyskinesia is energy. So what we see with a lot of the kids that we take care of is it's the same story. They're wound tight. As these joints shift out, the muscles start to create a pattern of protection. As we start to go into, I guess in what my mind looks like, the fetal position, as we start to do this, posture starts to round, shoulders come forward, but you start to utilize a lot of energy. Your body's working very, very inefficiently to try to just survive. And what we want to do is try to recapture some of that energy that is being wasted, so we can leverage it for more important things like growing, healing, adapting, learning, thinking, all those higher end things that don't happen when your body's in survival mode. So there's three things, like as we sort of, I know we're probably a little early, I talk fast sometimes. But as we sort of go into this next phase, this was the science. So the D's, the 5 D's are pretty much the sciencey stuff as far as what these fixations create, and to sort of map it all out again. Birth process, trauma, mom, stress through pregnancy creates tension within the body. That tension leads to communication issues within the nervous system, and that starts to lead to the myriad of symptoms that we went over that we talked about before we started today. What we do in our office is we run scans. We try to not guess. Our goal is to actually give you some facts. So we have 3 scans in our office that give us allow us to get some insight into how the kid's nervous system is wired, where it's pent up stress, and then also gives us a measurable starting point that we can remeasure to see progress. And some of the scans we'll go over, but I'll go ahead and introduce them before we do that. The first one that we measure is heart rate variability. Heart rate variability, there's just for instance, say your heart beats 60 times in a minute. The heart isn't going to beat every second on the second through that 60 seconds. Your heartbeat's going to vary. So it could be at 0.7 and 1.2 and 0.9. And the more variability within that heartbeat, the greater capacity you have to that stress. Okay? We're playing dodgeball now, and I've got your stress dodgeball, and I'm going to throw it at you. You want to be very variable with your motions. You want to go fast, and then you want to go slow, and the more variable you are with your motions, the less likely you are to get hit with the stress dodgeball. As stress starts to come in and you start to go into that fetal position, you can't adapt. You can't fluctuate those movements as much, and you're more likely to get hit. So it's a confusing concept, I think, when you're first learning it, but you want that heartbeat to be very variable. Consistency's bad. So we can measure this to see what capacity that nervous system has, and this is balance between sympathetic and parasympathetic is pretty much what we're talking about here. So we can measure what that balance is when we start to get that information about that child, and then we can remeasure to see progress or challenges they're having and how to best address them along the way. The second one we run is the thermal. We run a thermal scan. If we think back, one of the other D's was dysautonomia, so it affects how the autonomic nervous system works. The autonomics was the things that work automatically, blood vessels, organs, and glands, and so with that temperature thermal scan, we can actually measure where the autonomic nervous system is under stress and tension and not communicating communicating the information like it should. The third scan is an EMG scan. It measures that muscle energy, which is the dyskinesis. It measures how wound up that is. It actually gives us, and we'll look at this when we go over some of these scans in a second. It actually goes over and gives us a total energy number. So we can look and see what the output of that child's nervous system is and know where we want to go from there, and actually see trends as we go forward. So here's the scans. This specific one is an EMG scan. Just to sort of give you an idea of what we see with a lot of our kids. And we pointed out here, what we ideally want is we want this entire thing to be white. Anywhere that nervous system's under stress, tension, wound up, we get colored. Green's mild, blue's moderate, red's severe. So we see a few huge swings out there. Obviously, the one that we pointed out with the adrenal glands are really wound up in that situation. That's around that T8 area in the mid-back. The total energy, we want it to be at 100, and it's 210. So that's the kid's nervous system working like 110% harder than it should be, and we were just sitting there at rest. And so this is what we want to start bringing back together so that we can see everything's integrating more efficiently. Here's some pre's and posts. So here's our first set of scans, there's our second set of scans. So there's about 4 months difference between these two scans. So these are the same scans, and if we go back, the top and the bottom scan are the same. They're just printed out differently because they give us different numbers. This scan specifically gives us that total energy reading. This is that same child. This was their first scan. This is now their second scan. The nervous system's a lot quieter. It's a lot more efficiently working. That total energy number went from 210 to 123. And so that's what we want to do, and we start seeing as they start to recapture that energy and they start to use it for growth, healing, and repair. Now that barometer, that odometer that was on 8 or 9 is now on 5 or 6 or 4 or 3, and now we can have subtle changes to their environment, whether it be big crowds, whether it be homework, whether it be candy issues, and we don't set things over the edge because we've got a greater capacity to adapt to it. Here's an EMG of another child. This was another pre and post that we did. This was about 2 months difference. Once again, we're seeing some clearing out. We're seeing the pattern change. We're seeing the nervous system start to integrate things better so that they can start adapting to life.
Can I ask?
Yes.
It's a few months out, how many visits would that be?
Typically being is pretty consistently, and this is where we've got to break down the stigmatism or the perception of chiropractic. So typically you're coming 3 times a week
3 times a week.
on a regular basis. It takes that input. Like if you're trying to learn a new skill, if you're trying to learn an instrument, if you're trying to learn something and rewire the brain to learn it, it's going to take a lot of consistency to accomplish this. It's not like you would think of a typical, hey, 3 to 5, 7 visits, everything's glorious again. We can see changes quick, but to really rewire some stuff and see pattern changes, there's consistency to it. And like we talked about with that trend, that neuroplasticity trending chart, like the longer it's been there, the more hardwired it is, the more input it's going to take to change that pattern from what it was to what we would be more efficiently it would be. Make sense? Okay. We rerun the scans every 12 visits. So in our office, we rerun the scans every 12 visits to get that check-in on this is what the support's doing, this is the challenges that are still there, what's the next step, what do we need to tweak from here to address things differently. Pretty much as we conclude, the biggest thing to understand is subluxation means stress stuck on. Subluxation, which we haven't really talked about, is the chiropractic term for these misalignments that is creating all this dysfunction within the nervous system. And which is a very fundamental, simple way of saying it, is just the nervous system is stuck on. And that's what we're seeing with a lot of these kids that have, over the last 10 to 15 years it has changed, is they're just stuck on all the time. And as we talk to parents on a day-to-day basis, it's sort of the resounding thread through the whole conversation is they're just wound up. And if we can hit that parasympathetic nervous system, get things communicating better, we can start to see them start to adapt to their reality a lot better. So, questions?
How do people afford that?
We have very discounted rates for kids.
Right.
Sometimes insurance covers it. Obviously, that's an individual question based on what we're dealing with. And the biggest thing is just to get the information. Like, we don't have to, I mean, how it works in our office or most chiropractic offices that work like this, the National Wellness Foundation is a great resource to go to if you're looking for other areas or other people that like think the way that we think. But we sit down, we go through a day one, we kind of get the whole story. We run through the whole perfect storm, we take a full history, we run the scans, and then we sit down and we talk about it. And we get the information as far as like how much is there, how long has it been there, and then what's the best plan of action to like go from there. So as far as cost, like it's individual basis based on what we get back from the scans and what we get back from the history and how that all puts together. So, I mean, if we catch it young and they're 2 years old and they're just having ear infections, those things jumpstart real fast. if we're a teenager now and these things have been hardwired in for a long time, obviously there's a lot more that goes into trying to rewire that.
I have a whole list of questions, but I'll.
Sweet.
So, I'm sure part of it depends on what kind of procedures or readjustment, whatever, I don't know what it's called, you do, but like complications that could arise from that or the risk.
With
I don't know.
chiropractic?
So like that's, yeah, just, cause I'll just
So-
be real honest, like that
So-
scares the bejesus out of me
Perfect.
when you talk about C1, C2, cause
Yes.
I'm just thinking vent dependent.
Yeah. So when you've also got to think with most kids, what the adjustment is for most, I guess kids, we're talking 0 to 5 to 7 looks a whole lot different than what it does for you or me, or what maybe you've seen in the past. We're not typically osseously like moving the bones within that. They don't have the scar tissue, they don't have the resistance that you or I would have. So it's a very light, gentle process. Such as like testing putting pressure on your eyelid or testing the ripeness of a tomato. It's not heavy-handed and it's not like jerky movements like you saw with the OB doing. It's a lot less than that. We'll just put it that way. So
That answers some, I guess for me, it's just question, cause I mean, like, I'll just be honest, when you put the initial thing up there that started from like, either the infertility or like the birth thing, I mean, like, when you started going through it, I was like, almost wanted to cry, cause I was like, yep, that was pretty much our process. But, I just didn't know, like, what does it look like, and I know it's probably individual, and you can't just answer that, cause that's like saying that we're the same person. we're
exactly.
the same
And when we
thing,
put
but-
them in boxes when we go through this, it
Right.
is definitely individual as we sit down and talk. What does it look like as far as
It went into things like time, medications, so that has to do with that, because I know that you don't, but I mean, like, our child is on medicines right
Right,
now, and
right.
that's not something that we're going to cold turkey by any means.
Oh,
because,
no. And
So I
we
just-
definitely not say, no, we
So like,
wouldn't
when
do
you
that
do
at all.
scans and things like that, like, how would the medications change that, like, if it was like
How do
really
they
meant to
factor
calm
in?
them, like, yeah, how do they factor in?
So
And-
obviously they're gonna, depending on what the medications are gonna skew things a little bit. Typically the goal is to create some capacity within that nervous system and then start to wean off. Very thoughtfully wean off and start to get less dependent. And yes, scans are gonna be altered one way, or some of the scans, not all of them, but some of the scans will be altered by depending on, anti-anxiety meds or depression meds, or depending on what the medications are. So yes, that is all taken into account and, something we look at.
I was just real curious about that, the heart rate variability. I guess maybe I could talk to you after, cause I'm an EP nurse too, so like
Okay.
that, I'm trying to figure out what you mean by that. So I'm just trying to conceptually
Okay.
get that.
Okay.
That could be an afterwards thing, 'cause
Okay.
nobody else might want that.
Okay. Anything else, any questions? I didn't do a very good intro on this place when I first started, that was my goal. This is Wellness Revolution. We are a entire wellness center. So we do fitness stuff in the back, we have kids CrossFit classes, we have yoga classes, we have chiropractic, we have massage, we try to help people live their best life. And so I'm the chiropractor up front.
So you work here?
Yes,
Okay.
this is my place.
Okay.
So I'm the chiropractor up front, and we just try to connect with families and from kids to adults, and try to help them engage in life the best they can. So if you got any questions about that, about anything else that we do here, there's pamphlets, there's brochures, there's lots of other things that we do. But we definitely work with a lot of families and kids through these struggles. All right. So like I said, if you have questions, my email address, if you take one of my business cards, it has my email address on it. So if you do have some questions and don't have time to say after right now, email me, call the office. I'd be happy to return a phone call and try to connect with y'all and answer y'all specific issues or challenges, or just sit down and talk through and meet with y'all individually to figure out what we can do to help to get some children back up and running again, or create some more capacity. So thank y'all. Have a good night.